I'm Dr. Greg Phillips. I'm a physician here at the NeuroSpine Institute. I'm board certified in physical medicine and rehabilitation, sports medicine, and also interventional pain. I'm originally from California, but moved to Oregon as a child and went to high school in Oregon. Ended up going to the University of Oregon here and played football here, and then went on to the University of Washington and went to medical school, and then decided to come back here because I wanted to move back to the community that I love, and also I wanted to take care of some of the athletes over at the university. My particular interest is in musculoskeletal medicine. Being an athlete here, I had to deal with a lot of different injuries: spine, shoulder, knees, ankles, you name it, I heard it. And so I think I have a unique perspective in taking care of patients for musculoskeletal injuries. I take care of athletes over at the university and really enjoy that part of my practice. I do a lot of procedures, injections. I do procedures on the spine where I do injections in the spine. I burn nerves. I implant stimulators. I implant pumps. And so anything that hurts, my particular field is to really take care of pain and try to reduce somebody's pain. I also do chronic pain management, so I will prescribe patients pain medications long term. That can also be rewarding because I can see patients that their primary care physician maybe doesn't want to give them pain medications, or they've had issues with pain for a long time and have now graduated to higher dosages of pain medications, and I can effectively manage those for patients and hopefully give them some of their life back by treating their pain. So when you schedule an appointment and I see you on that first visit, I try to make sure that I spend as much time as you need. I try not to stick to a real tight schedule. I think that you can get 90% of the information that you need from somebody just by listening to them. You know, that 10% is maybe the MRIs and X-rays and other stuff, but that 90%, if you just listen to somebody, they're going to give you all the clues that you need to figure out what's really going on with them. Plus, most of the patients I see are pretty complicated. They've already seen multiple other physicians, may have already had treatments for their particular problem, may have had physical therapy, may have had some injections, maybe some medications. And so we don't want to rewrite the book. We really want to listen to somebody and then take where they are now and then hopefully then progress that through the treatment program that I have. So the NeuroSpine Institute, our goal is to get your life back. That's what our stated motto is. We want to get you back to doing your activities, whether that's playing a sporting event, whether that's golfing, or whether that's just going for a walk on the beach. Whatever that is, we want to get you back to doing that. How we do that is we do that through therapy, through injections, through surgery, whatever the particular thing is that you need. It's what we try to do for you to try to get your life back and try to hopefully treat your pain so that you don't have to continue to have pain and can go and do some of the activities that you really want to do in life. So I've been married now for 12 years. I have 3 children, ages 9, 7, and 3. We're all very active. We all really enjoy sports and like going and doing activities. My boys play football and basketball and baseball, and they love it. My daughter, a little too young for that right now, but we really like to get outside and do things outside. Our goal always on every weekend is to get outside and do something. We don't like really hanging out inside. My wife and I moved here about 7 years ago. The reason we moved here is because we wanted to be more active and do more outside activities. We were living in California temporarily and decided that we wanted to move back here. I told her all about Eugene and how much I loved Eugene when I went to school here and how many activities there are to do: fishing, hiking, you know, all this stuff that we couldn't really do very well when we were in California. So we really enjoy that. We really love getting outside and doing a lot of activities. We also love going to the games here, you know, going to the basketball games, baseball games, and football games. And since I played football here, I really like my kids to kind of get involved in the activities and sports. I think there's a lot of teaching that can be done through sports, learning how to set goals, learning how to follow through on goals, and learning just to be good humans. And I think this is a good place for that for kids. They have a very good influence, or a lot of good influence around them in the school that they go to, and the families that we hang out with. We're all kind of like-minded, and I love living here. I think it's a great place to live and a great place to raise your kids.